The debate on the potential contribution of tobacco on Zambia's economy, which has its own fiscal challenges, versus the health toll that the negative impact of tobacco has gained significant traction recently. Today on the People's Space, I'm privileged to be hosting Brenda Chitindi, and we will be discussing the subject of tobacco. It's great to have you on the People's Space.
Thank you very much.
All right. So let's just kickstart this topic by according our viewers an opportunity to get to know who Brenda is outside the work of tobacco control.
Brenda Chitindi is a woman, a former civil servant, and after retirement, I had to do some, apart from looking after my grandchildren and children, I involved myself into church programs where I normally spend my time, worshiping God every time I am free. And most of the time, I take a bit of time to worship God.
Okay, interesting. So apart from maybe church activities and this other stuff that you do, is there any other hobby that you have? It could be gardening, reading, some. Nowadays a lot of people are watching football and doing all kinds of things all together.
My only interest now is just to look after grandchildren.
Okay.
Yes.
And how has that been?
It's very interesting because they motivate me and they keep me busy instead of staying idle, thinking. So they really occupy my space, and I'm grateful about them.
Okay. Interesting there. Interesting. So now let's get into the subject of tobacco control. What really inspired you, coming from the background that you've just highlighted here, what really inspired you to start working within the space of tobacco control?
Yes, I was trying to find out, my interest was mainly to find out why are people interested in just that smoke? See, I was trying to make sure that what do they gain out of that smoke? Because, for example, when you have bananas or apples or potatoes, you have that appetite to eat it so that at least you are satisfied. That hunger goes. Now for tobacco, I was very, very inquisitive. This tobacco, this smoke, why are people so much addicted to this smoke? Then I just went on investigations that is nicotine, that they're interested in it, and I went more to discover why this nicotine so much addicted to people and that they continue smoking. At the end, I was just told by medical professionals who are close to me that actually it's not safe to smoke or to use these tobacco products because they are harmful. Yes.
So when you say it's not safe, obviously you've lived longer than all of us, in this particular room doing this particular production and most people out there. But what stories can you highlight, that demonstrate the impact of tobacco on individuals and maybe communities, people that you've seen yourself?
Yes. My late father, was a chain smoker. He used to smoke even in the night. The village houses, they normally build either 2 rooms or 3 rooms or so. But whereas our home, the house that my father built, it was a 3-roomed house. We used to have our bedroom, their bedroom, and the sitting room. And we smoke the whole night. And the ventilation,
Wasn't that
very
good?
wasn't there.
Yes.
So at first we used to enjoy, dad is smoking, my father is smoking. That smoke also, we got so attracted. Yes. And he was a chain smoker. And the time I started work, in the village, because he used to smoke royal on. So just for him to show off that he educated children. And what I did was, I didn't want him to be smoking royal on. I used to buy him boxes and boxes of cigarettes so that it shows off that
now it's the children who work.
Yes,
he has done a good job as a parent. Yes.
Now he can smoke the cigarettes.
The good stuff.
The good stuff, yes. Without knowing that I was part of the contribution. Until at a later stage, smoking does not immediately, the effects of smoking, they're not immediately when you smoke. It's a process that takes long to manifest. So the time he was old and he was not feeling well. But still more, he was smoking. And the village time, because we just learned that it was cancer, prostate cancer. Yes. So the time he was sick, it was a very sad situation. And we tried to take him to hospitals here and there, but like operations, he didn't want to be operated on. He just said, no, I don't want to be operated on. I don't know what he believed.
Oh, so from your personal experience, obviously you've had more years than the majority of us, would love to find out, what are some of the personal stories you can tell with regards the impact of tobacco, say, on an individual or a community at large altogether?
Thank you very much. My experience on the personal issues on tobacco is that my father was a chain smoker, lived at the village, and he smoked almost, I would say, after maybe 30 minutes or so, he would request for
cigarette,
for his royal on at the village. And he used even to, in the field, he used to have a portion where he grew some tobacco leaf for his usage. And he used to smoke. And we lived in a three-bedroom, a 3-room house in the village where he used to smoke even in the night. And the smoke used to circulate in the house. And those houses, they don't have windows, no proper ventilation. So we were all, we're also inhaling that smoke. So the time I started work, I just wanted my father to show off to his fellow villagers that he educated children. So I used to buy him cartons. Are there cases or cartons? Boxes of cigarettes. And that time it was life. And that word life, we thought it's life. Huh? It's life. So each time we would go to public places, because he used also to drink, he would just take off his cigarette and smoke. And all the people or the neighborhood who admired him, that, This one has got to go educate the children. Look what the way he stopped the royal on. Now the children just bring him cigarettes. So without knowing that, I contributed part of his suffering, his illness, because at one stage he suffered for a long, long, long time, prostate cancer. So we didn't know at that time whether it was smoke or tobacco. But what we did as a family, we just pointed at an innocent person that this is the one who has bewitched our father. So it was so touching that even at his death, he told the wife, my mother, light me a cigarette, just signs, because he stopped talking. Then the wife, my mother, put him a cigarette just to have that smell until his death. So we just picked on somebody, very innocent person, that you are the one who
bewitched him,
who bewitched our father. Then after some time, after discovering the use of tobacco, then I told the family, it's tobacco.
We made a mistake.
Yeah, we made a mistake. We tried to apologize, to go to that person whom he literally refuses. You've already dented my name and I'm not going to forgive you. We tried to plead with him. That was tobacco. So now that's the time I just said, no. Let me be a strong advocate on smoke-free environment.
Makes a whole lot of sense. I mean, looking at where you're coming from and that story. But before I move on, I've been seeing a trend, as a young man, I sometimes go to these places. And when you look at the same tobacco itself, it's evolving, it's changing, it's improving, from the ones that you were buying those days. Now we've got even better with flavors and all kinds of things. But one area of concern, which I know you're aware of, is the numbers that are increasing. If you look at the number of young women that are smoking nowadays, the shisha and all these things, it's really, really worrying. What do you think is the cause of that? I mean, in the past, in your days, you can agree that tobacco mainly had a whole lot to do with the men, in the village, in the community, it was the men that would be smoking, whatever it was, the balan or whatever it is that they were calling it those days, but they would be smoking it, it was the men. But nowadays, we're seeing a lot of women, young women for that matter.
No, the trend come with the current situation. How do I put it? Maybe at times you find that they go to public places, especially the girls, and even the boys. They go to public places. They see very, very attracting. Somebody smoking, or the current gadgets that in the country now, they think it's a new era, it's a fashion. So they want also to start, that's the peer, I would say peer pressure. This one is doing this, let me also start, so that I'm also seeing that I'm part of this
new trend.
Yes, the new generation life, I would say it's so. Just to attract other people that also, it's just like beer. You see somebody very drinking, and somebody doesn't drink. Let me try also to drink. It's almost with tobacco. They
So
you get this peer pressure, and also to show off that you are part and parcel of that the new system that has come into the country.
And then you have another issue again, which I've heard. I don't know how true this is, but I've just heard from people. There are these beliefs. For example, there are different types of tobacco. You've got these electronic gadgets now that you're referring to, which people are using, and then you've got the traditional ones now, like the nsunko. When we go to these public gatherings, the funerals, the family meetings, you'll find a lot of women, they've put stuff in their mouth. They are doing the nsunko. Others, we've even heard stories that they're even putting nsunko in other places due to certain beliefs. It keeps the body warm, it does what. What are your thoughts on these things, on these myths? What would you tell the young ladies that will be watching us right now?
Actually, I've seen young girls, snuffing suko, putting their under the tongue. And I got interested. Then I did ask one of the girls, what's happening with this? Says, no, mom, they make us warm. They are to attract our partners, male partners. We even insert them in our private parts. Yes, for us to, our bodies to, when our male partners, when they're together, they feel very nice and safe. I mean, that the temperature I'm told it's warm, and the male partners enjoy them while they're in that situation. And also, others are saying, like elderly people like me, I say, no, it's medication. What kind of medication? What disease are you suffering? No, coughing, sneezing. I said, but when you use it, it's when you sneeze more and you cough more. Says, no, we are just taking out that for us to be relieved. There's so many answers that they give us. So we are just surprised. And this is very marketable now. Very marketable, especially with the girls. Especially when they take beer. You find them in the toilet where they use them. They're all sharing the sukos. Yeah.
So, but I mean, as a person that has experience, as a person that has seen these things, would you tell the young ladies that? And I know you've been exposed to some of the results and the findings and the studies, just to dispel some of these things. Would you tell the young ladies that those things is there truth to that anyway?
There's no truth in suko on that. At times our culture is quite difficult. Maybe we have about 72 tribes in Zambia. Other culture will believe in that one. Others will not believe. But as far as I'm concerned, I don't believe in that one, because definitely it's the way you conduct yourself, not supplementing other
things,
other issues like suko, which definitely, after I learned about the suko, I did my own investigation. I went to Cancer Hospital just to find out exactly, and also with the research that these professionals have come up with, says suko is not safe. It's one of the risk factors to cervical cancers.
All right. So you are watching the People's Space podcast with me, Wenton Mavor, and my guest today is Brenda Chitindi, an advocate of tobacco control from the Tobacco Free Association of Zambia. And of course, we are delving into the subject of tobacco. Now, to all our fans and followers of this important and amazing show, first and foremost, I'd like to appreciate you. And again, I've got some great news for you, as you can win some interesting and spacious prizes. I'm talking about caps, t-shirts and mug cups, and of course, many others that you will see as we go along with the program. But all you simply have to do is simply like our social media pages under the handle the Center for Trade Policy and Development, that is Facebook and YouTube, and where we do air episodes of this particular People's Space podcast. And you can also take advantage and like and find us on X, which is formerly Twitter, Instagram as IG, men would call it, and also TikTok under the handle CityPD Zambia, where the episodes are posted. Make sure you like these platforms. Invite at least 10 people to be able to like, engage, and interact with these platforms, and you will stand a chance to win some of those amazing prizes that I just mentioned. See you shortly after the break as we continue.
Hello, I'm Professor Faston Goma. Catch me on People's Space as we talk about tobacco control in Zambia. Thank you.
Welcome back to the People's Space podcast with me, Wenson Mavoro. My guest is Brenda Chitindi, and of course, we are discussing tobacco control in Zambia and exploring various avenues that are related to this particular important topic. And to those of you that are our amazing fans and followers of the People's Space podcast, you are at liberty to be able to at least invite 10 people to be able to like and interact actively with our platforms on Facebook, the Center for Trade Policy and Development, and on YouTube, the Center for Trade Policy and Development, on Instagram, Twitter, which is X now, and TikTok, it is CityPD Zambia. We do share content related to the People's Space podcast, which ranges from episodes, teasers, and other related content. So interact with us and stand a chance to win amazing prizes ranging from t-shirts, mug cups, capes, and of course, other interesting prizes that you do not want to miss on. Having said that, we now continue with our discussion. So earlier on, Madam Brenda, you did tell me that, you're actively involved in church, which is a good thing, and spending a whole lot of time now with your grandchildren, trying to, and I know it can be a whole lot because I used to be a grandson at some point. So if I remember the trouble I was causing my grandmother, obviously I know you have a whole lot of work on your hands. But one area that people maybe would love to know about you is, are you married? Like, how many kids do you have?
I have 5 children. That's two girls and 3 boys. I would say men.
Now,
Men and women. 73 years old and a widow.
Okay.
Yes.
Okay. Interesting. In my family, there's 3 girls and 2 boys. Okay. What an interesting opposite. But anyway, as we pick up our conversation, I would like to get your thoughts on there's been so much push from civil society organizations and other related stakeholders with regards the push for the enactment of the tobacco control bill in Zambia. But of course, there have been some delays. What are your thoughts on that?
First and foremost, like the tobacco control advocate, I started in 1996 advocating for smoke-free environments. And we have been pushing for smoke-free environments even before Zambia acceded to the World Health Organization Framework Convention on Tobacco Control, where they ratified in 2008. So you can see I started in 1996 advocating for smoke-free environments because of the background that I have already explained here. Yes. So when Zambia joined the global world to see to it that tobacco is reduced or is stopped, what we did as an organization, that's the time I formed the Tobacco Free Association of Zambia, so that I can have at least a backing or a backing with my advocates because of the legal entity that I formed. And from 2008, We've been advocating for Zambia to domesticate the World Health Organization Framework Convention on Tobacco Control, that it should have its own laws to protect the people of Zambia. And we started the tobacco control bill, the process, in 2009. Yes, that's when we started the tobacco control bill process. That's with Ministry of Health and other land ministries, and as civil society, we used to meet every time. And in 2010, what happened was this: they called us to finalize the bill, the tobacco control bill. But during that time, we were just surprised because it was the tobacco industry that supported that process, that meeting. So when we discovered that it's the tobacco industry that has sponsored this meeting to look at the tobacco control bill, we civil society, it was myself, the late Mehiso, rest in peace, Muyunda Ilonga, who was his Zaka executive director, and other stakeholders. What we did there, we just said, no, this process, we cannot be headed by the industry. And according to Article 5.3, World Health Organization Framework Convention on Tobacco Control, you do not interact with the tobacco industry because you have separate, we have separate focus, that we are focusing on public health and them are focusing on profit. Now, how can they lead a meeting or sponsor a meeting like that? And we had to do a lot of advocacy, and the world, the global world caught up the issue. Then from that time, it was very, very quiet until 2018. That's the time the tobacco control bill was reactivated. And as we started, even though we started reactivating, but still more, the tobacco industry definitely have been very, very strong to disturb or to distract the process of the tobacco control bill. Yes.
Having closed 2024 and now into 2025, and of course, the tobacco fight has received some new energy. How would you say Zambia has performed on the Global Tobacco Interference Index?
Zambia has performed very, very poor. I would say bad, but it hasn't performed well because the tobacco industry interference into policy making, tobacco control measures, they've really interfered in the tobacco control process. Yes, for like the Tobacco Free Association of Zambia has been investigating and exposing the tobacco industry activities since 2020. And at global level, I would say at national level, at regional level, that's the region of Africa, we have performed very, very poor, very, very poor, including also at the global level. Like in 2020, we were the third one. The first being Japan, Korea, and the third was Zambia. Poor performance, the interaction of tobacco industry. It has been very strong. in the policymakers' process on tobacco control activities. And definitely, we have performed very poor in Zambia. We are real interfered. The tobacco industry is very strong than public health activity, very strong, disrupting public health measures on tobacco control issues.
You mentioned that the fight sort of received a spark, the advocacy with regards focus on the bill and everything in 2018. And here we are. How would you say the current regime has performed with regards having the tobacco control bill enacted? Do you think the current regime has done enough? Or even since 2018 was still in the previous regime, in the PF time, how would you say both regimes have done when it comes to pushing for the enactment of this bill?
I would say since 2018, because of these political changes, it has also affected this process, the tobacco control bill, because like the previous regime, we tried our best, but we tried our best, but we didn't see it coming forth. So we have continued to the present regime. Like looking at things now, I think we are getting somewhere that understanding us, even though also the tobacco industry is very, 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 very aggressive. I would say very aggressive. Yes, to make sure that this bill is not enacted in Parliament. Yes, but we also, as advocates, we are also becoming aggressive now to help the people, to help the public health issues, because our interest is public health, to make people, live a longer life. Yes, and looking at the interference that the tobacco industry are doing now, they are capturing younger people, like what I've already said, within these new devices. You find a lipstick, it's a tobacco product. There are a lot of new devices that they've brought in, but we are not going to rest as tobacco control advocates. And of late, what we have done is all the advocates to come together, speak one language. I think we are getting somewhere.
Okay. You talked about when we're looking at the Global Tobacco Interference Index, you referred to Korea, Japan, and Zambia being in the poor performance brackets. When we look at the opposite of that, which countries in Africa specifically can you maybe highlight that have successfully implemented strong tobacco laws? And as a country, what can we learn from those countries that have seemingly done well in that area?
For the African countries that have done very, very well, one is Botswana. Botswana have come up with a very, very good laws that I think to sustain the public health area. And also Uganda. Uganda also, they're very strong advocate that they've come up with a very good tobacco control law. South Africa, Kenya, Nigeria. Yes. But looking at one of the best, I think Botswana is the best. They've come up with a very, how do I say, the law where once you are found smoking in public places, at least the fine is very, It's very strong that people, they're afraid to use because of that fine. And also Rwanda. Rwanda has done very well as well. Yes.
Okay. You mentioned interestingly about the sophistication in terms of products, and convenience. People have come up with it's not just something that a girl needs, like lipstick, which they use often, but it's also a gadget that what are they calling them now? The vapes, it's you can just vape something out of it. How can we how can we address this? Because there's a whole lot that's being done now. I've seen others with a pen, somebody was writing and in another second you're like, I thought that was just a pen. So how can we address that?
The only time or period we can address that is when we come up with a strong tobacco control law. Because right now there's no law. Yeah. That's why we are advocating for a strong law to be enacted in Zambia. And they're also looking at the advertisement. There are a lot of adverts going around. Like one time I saw one, is it East Park Mall, where they indicated Sundays are for shisha. Can you imagine? Discouraging people to go to
Sundays
church.
are for shisha. Interesting, eh?
But to come to their premises and
do some shisha.
So definitely we need to, the government we really need to do a lot of look into the issues of advertising. And also you find these vendors, they sell near the schools, close near the schools. Very attracting adverts. So children are getting attracted to those. So we need a strong law on that one.
Interesting. I like that. Before we get to conclude our conversation, still on the subject of advertising, I know that sometimes it's very tricky to regulate, but it's possible. That is the beauty about it. It's very tricky, but it's possible. How are you collaborating with key figures in our society, such as celebrities, a whole lot of this population or segment of our population that young people are following? Talk about the musicians, the actors, and all these guys. Some of them you'll find them in commercials of tobacco and they're paid a lot of money by the industry. And young people, 14, 10 years, 8 years, idolize these people. As advocates, are you also talking to these guys to try and see them the importance, to show them the importance of the negative consequences and effects of tobacco, not only on human life, but even on the economy at large, and how key they are to changing the narrative?
On that one, we've trained the youths to talk to their fellow youths. And I think on that one, they're doing very well because they've gone out completely, sensitizing their fellow youths, encouraging them, and also informing them that they're damaging their lives as tobacco is not safe for their health. So the only thing that we can be supported is coming up with a very strong law. Because without law, how do you control it? Because you have no backing. You need to have an evidence-based, so that you inform them that once you do this, this will happen. But as it now, Zambia has no proper law for us to go further deep down to sensitize or to inform these people to reduce or to stop smoking. That's why we are looking at to have a comprehensive law to cover all the advertisements And smoking in public places, just for example, what happened to Minnesota Hospital? Somebody was smoking. Then they had to, the hospital almost was on fire because of the tobacco. You heard about it?
Yes.
Huh? Now, that a cigarette costing a 10 kwacha, I don't know whether it's 5 kwacha or 10 kwacha, to destroy the whole hospital or to make those movements, shifting patients here and there. Those are the things that we really need to come up with a law. Zambia should come up with a strong law. And besides that, Zambia is spending a lot of money. These non-communicable diseases, the cancers, the hypertensive heart diseases, diabetes, the chronic respiratory diseases. Those are mostly tobacco is one of the most risk factor. And how much does the government spend on those? Or our home income, how much do we spend to treat? Because even last time, I just learned that Zambia sent about 30 patients, cancer patients to India. How much did the government cost? The government can avoid all those things by protective measures to make sure that we have a strong law to protect the health of the people.
As we get to wrap up our conversation in the briefest possible way, what are other initiatives that the Tobacco Free Association of Zambia is implementing or expected to implement this year to further enhance your engagement with policymakers and other like-minded entities to push for the enactment of the Tobacco Control Bill?
Just like my organization, the Tobacco Free Association of Zambia, we're up in arms exposing the tobacco industry activities so that they pave way for the Tobacco Control Bill to be enacted. And even in the policymakers, we have been meeting with policymakers, explaining to them why the Tobacco Control Bill is important. And they should not be distracted by the other group, the tobacco industry group, because also the tobacco industry are using their front groups, the Zambia
Association of Manufacturers.
As if, but they're behind the tobacco industry, they support the tobacco industry activities. And you just wonder, how do you compare between profit and the health? You can have money, but at times you have a disease which cannot even be assisted by the finances that you have. It's out of how do I say it? You can have money, but maybe you cannot even enjoy that money because of the sickness that you have. So, healthy is first before money. So, what we are telling the government that public health should come first before profits, the revenues that you are getting from the tobacco industry.
Interesting takeaway there. Public health must come first before the revenue. So it's health before profit. And my guest has been Brenda Chitindi, an advocate of tobacco control in Zambia, coming from the Tobacco Free Association of Zambia. And of course, we have been discussing tobacco. And I'd like to take this opportunity to just remind those that follow keenly our program, the People's Space podcast on various channels, that you can actually have an opportunity to be able to win some amazing prizes ranging from mug cups, caps, and of course t-shirts, and many other interesting items that I will not mention but leave you with a suspension, as you might not want to miss them. But of course, you may be asking, how do we get an opportunity and a chance to be able to win some of these amazing prizes? It's very simple. All you simply have to do is invite at least 10 people to be able to like and interact with the People's Space podcast episodes or programs on our platforms. And these include the Center for Trade Policy and Development on Facebook and YouTube, and CTPD Zambia on X, which is formerly Twitter, TikTok, and Instagram. And once you do that, you will stand a chance to be able to win some of those amazing prizes. And beside this great and exciting opportunity, we also want to get to hear from you. What are your thoughts on these important topics that we do touch on this particular important platform? Remember, it is the People's Space after all. So we are very much keen to hear from you and to hear your thoughts. From me, Winston Mavor, thank you very much and see you next time.